Get started. You have joined us for Hire Smart, Start Strong, transforming onboarding for substance misuse prevention professionals with Louise Montag. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in the webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. We have a few housekeeping items. Ooh, and Chen Winslow isn't with us, so you're going to message me, Rebecca Buller, if you need some help with technical issues. We ask that you put your questions in the Q&A section, which is found at the bottom of your screen. This helps us not lose it in the chat, and we're going to be using the chat quite a bit, so that is a likelihood. So please use that Q&A because your questions are important to us. If captions would be helpful, use your Zoom toolbar near the bottom of your screen and choose Live Transcript. AI note takers are not allowed in our trainings and will be removed from the Zoom room. And finally, certificates of attendance will be sent via email to those who attend the full session. And now I am going to turn things over to Louise. And she, just so you know, she is a public health professional with a decade of experience specializing in substance misuse prevention. And here we go.
Thank you so much, Rebecca. And I am going to share my screen to get started with today's presentation. So, really excited to be here. As Rebecca said, my name is Louise, and we're here for Hire Smart, Start Strong, transforming onboarding for substance misuse prevention professionals. Now, a few housekeeping slides to get started. The first one, our language really matters. And if you've seen me speak in the last year, you have seen this slide. I share it for two reasons. One, to share and lay a foundation for language being really important. And by that, I mean I prioritize person-centered, stigma-free language in all of my discussions and materials. And second, I use clear evidence-based terminology to foster understanding and engagement. With that, I'm human and language is ever evolving. And so I ask that if there's something that I say or something in my materials that doesn't resonate with you, that you call me in and I can make those adjustments when I know better. And so I'm committed to that continual learning and adjustment as needed. Also, our objectives for today, we're going to really define the role of the prevention specialist and best practices for attracting the best candidate. We're going to apply the principle of capacity building to our onboarding plan and design elements of a supportive onboarding experience focused on engagement and retention. And so that's really the focus of today. But before we jump into that, I'm really interested to see kind of why and where you're coming from today. And so I really appreciate people sharing where you're from in the chat. But if you don't mind, I'm using Mentimeter today. And so you're welcome to either go to menti.com and use the code 2471592. And you'll see the same code at the very top of the screen or to the right. You're also welcome to use that QR code, which is going to drop you right in the link for today. And then you can share why you're joining today. So are you looking to hire someone in the next 6 months? Are you wanting a better hiring protocol for your organization? Are you just looking for additional information? Or did you come here for those CEUs? You need a few more in order to either certify or recertify and are just needing those CEUs. All right. I'm seeing more people are joining, so I'll give you just a little bit more time because I know sometimes it takes a while. And with that, I am using Mentimeter a few times throughout this conversation today. And so if you want to keep this page open, either in your phone or in another tab on your computer, feel free to do so, and we'll refer back to it periodically. And I'm still seeing where other people are coming from. I love it. All right. So we have people coming from really across the country. Oh, we have a few people who need to hire soon. That's wonderful. So hopefully we're going to give you some good tips and information to do so. And otherwise, I'm seeing a good amount of people, decent split, but most people probably just wanting a better hiring protocol. And a few who came for the CEUs, if you did, hopefully you also get something out of it. And this is a valuable session for you, in addition to getting that certificate and submitting that. All right. So, a follow-up question with that. Feel free to type into the chat. What did you want to be when you grew up? Maybe an astronaut like that little kiddo that's on our screen. A health teacher, very similar to prevention specialist. All right, teacher, an attorney or Superman. I love it. Dolphin trainer, helping homeless people or people who are homeless, a vet or a realtor, cosmetologist, a lawyer. We have some great things. Doctor, veterinarian, figure skater. Ooh, especially with the Olympics right now. I'm loving it. Therapist, archaeologist, a farmer, a writer, a hairstylist, a musician. Sometimes I get like rock star or someone in the Rockettes, and I absolutely love it. That is not me. But I always appreciate the boss. Wonderful. I think it's helpful to kind of see and hear that background of what we wanted to be when we grew up. So a little bit about myself. I had a passion for helping others, and this really started at a young age. My mother was a teacher. My father is a financial advisor. So all I knew from that was he wore suits to work every day, and it was kind of boring. But I did see what my mom did as a teacher when I went to school every day. And so I started off wanting to teach and support others. By around fifth or sixth grade, probably, that switched over. I wanted to be a doctor, not any physician, but an emergency room physician. So I started college. I continued. I volunteered in the medical field. I started college with a pre-med major. I participated in any chance I could doing something in the medical field. And while I loved working in the hospital, I saw some of the bureaucracy and thought, this isn't so much for me. I also saw patients who came in on average, probably 34, 35 times per month, which is at least once a day, if not sometimes twice a day, coming into the emergency department. And I thought there's got to be a better way. And so I kind of switched things up. I went back and worked with my advisor and decided instead I was going to switch my major from public or from pre-med to public health. And so when I started going in public health, I really wanted to focus on that mental, emotional, behavioral uh, workforce or that section of work. Beyond that, I started working with college students. I fell in love with that population, absolutely loved that college student group. And so I started working on a college campus doing a lot of stress reduction, suicide prevention, a little bit of AOD prevention, which is alcohol and other drug misuse prevention, but very little of that. And then that role was naturally coming to an end, and I needed to find another job. I found a position was hiring for somebody working in with college students in substance misuse prevention, really providing that support, training, technical assistance. And I thought, okay, that's, substance use disorders and prevention is similar to some of the other stuff that I had been doing, mental and emotional, behavioral prevention and health. And so there's a close adjacent, can't be that hard. This will be fun. And it's perfect working with that population that I love to work with. And so I kind of stumbled into the role. I didn't know a lot about substance misuse prevention before starting, but I did have that background in public health, which did help me kind of move forward and move into the work. I also knew a little bit about working in suicide prevention and stress reduction, things like that. And so I think there was a lot of overlap and support with health promotion leading into prevention. So that's what kind of brought me here. And then I've spent years working with supervising and supporting individuals, hiring people in. And so a lot of this presentation comes from the research that I had to do as I built up my own skill set as a supervisor, as well as just my own personal experience. And so we'll talk through that. But first, if I were to go through pre-med or gone that doctor path, there's a career stepping stone, right? So we start as a medical student, then we jump into that internship, then go to maybe resident. If we want to specialize, we're going to join a fellowship and become a fellow. Otherwise, we jump right to attending upon graduation, board certified. And then if we end up leading that department, becoming a medical director. And there are those clear steps, and you're not really jumping around too much. You might skip between resident, jump up to attending, but outside of that, you're really following this method. Whereas the prevention field is a little bit different, right? So I like to visualize it as more of a career lattice. And this is a model of career development that really provides employees with flexible pathways to grow and progress within an organization. Really moving beyond that traditional and linear career ladder, it emphasizes lateral, diagonal, or vertical promotions, really allowing employees to broaden their skills and experiences across different roles and departments. This allows for flexibility, skill diversification, a focus on growth, increased engagement, and reduced silos. So it can be really incredible to lean into it. And we need to recognize that just because somebody has been a prevention specialist in one coalition doesn't mean that they're going to do the same work in your organization. Maybe not even doing coalition work at all, but still working in prevention. It could also mean that people will jump in and move around in different ways. And so we fill different roles in the community that may require a different skill set. And so this is unique, but it's also kind of special about the prevention field. And I think it's helpful to understand this as kind of that framework baseline as we're talking about hiring and onboarding new professionals. Additionally, with this, or when we are hiring, out of the and I saw this a little bit with those who are posting as well. So I have a feeling I'm not alone here. But in nearly all of the hires that I have managed, I've needed someone in that role 1, maybe 2 months ago. I'm flying by the seat of my pants. I may have thrown together a job description just to share out as quickly as possible. Maybe ChatGPT helped me out a little bit, or I copied something over from that last role or person. I'm scrounging together any little thing I can get just to get it out there as quickly as possible. And I found that when I slow down and really start with this first step of performing that job analysis, really understanding what is this person that I'm hiring, what are they going to do? What is the importance of their role, and who might be a good fit for that? When I slow down and figure out that, it helps me to hire a much better fit later on. It also really helps as I get into supervision because the more clear and consistent communication I can share, the easier it is for me to or for them to understand and succeed in their role. It also provides a framework for that ongoing evaluation and growth. And so it really sets you up for success long term in understanding what is that person that we're trying to hire for, and what are those skill sets that they need. So I do have a few resources to get us started in thinking about some of this. The first one, and this was created by our very own Erin Ficker, so thank you very much, and the PTTC. But I love this guide and I've shared it out with new hires frequently. It's the many roles of a prevention specialist. So really understanding that we hold different hats and wear different hats. throughout, depending on the role that we have to do for that moment in the job that we're required to do. So sometimes we're conveners. We're assembling people for that common purpose. Sometimes we're organizers, people who forms and organize groups of individuals. Sometimes we're facilitators, really trying to bring about that outcome from those differing viewpoints. Sometimes we're leaders or provocateurs, really inspiring someone to take action. So, really understanding who is this role of a prevention specialist or what hats is this person going to wear. Another resource that we have is the ICNRC Candidate Guide. And thank you, Rebecca. You just dropped that link in the chat, which is fantastic for that candidate guide. But you'll see, I can't remember exactly, but it's one of the first pages. You'll see it says that it's a job analysis at the end of the day. So this candidate guide was created by a group of subject matter experts, or SMEs, because we love to have acronyms, right? Across the country. They all hung out in Florida because it's a fantastic state to meet up with, especially if you're coming from Michigan in the winter. And they decided on a list of jobs that a prevention specialist does in their role. Now, you might see that we might not do all of these tasks on this list in our current role, but it might be a good spot to really understand that starting point. What pieces of this job analysis that's already been created for us can help us to determine what are those roles for this job that you are hiring for next. So, this could also be a really helpful guide or to share with those who don't have a background in prevention. Some of us are in a position where you're like me. I had a very small staff, and I was the executive director. I was also the HR manager, the hiring specialist. I did a little bit of finance along with our accountant, and marketing was under my title and everything else. And so we are having to figure out and hire for this person ourselves. Others on this call might be part of a larger team, maybe the health department, or hired by a larger agency that has maybe a treatment recovery agency that has an HR specialist. If we are fortunate enough to have that extra support, the one caveat to that is that sometimes they don't have that background or understanding of what we do in the role of prevention. Really trying to bring them up to speed and sharing all that you can as far as what this person is going to be doing and the skill set that they're going to need is going to be really helpful to make sure that we're all on the same page when we visualize this new employee. So I highly recommend for you to download or print a copy of that candidate guide and then go through and highlight those tasks that that person is going to be responsible for, because that might be able to be the start of your job analysis for this person. Another resource we already have is SAMHSA's Prevention Core Competencies. And I know Rebecca's going to drop this in the chat as well. But this resource really lists those knowledge, skills, and abilities, or KSAs, for prevention professionals. Again, I highly recommend that you either print or download this document and go through and highlight those skills, knowledge, and abilities that are going to be important for this person's role, because that can be a great start. Now, I will say these documents are really great and they're helpful tools as we get started, but they're really specific to prevention. So they might say things like, relating back to the SPIF, the Strategic Prevention Framework. Well, I'm going to tell you, before working, I told you I kind of stumbled into the career or into this career. My background is in public health. I knew public health models and theories, but I didn't know the SPIF. So if you told me to follow the SPIF, I would have been like, I don't know what that even stands for. And so really making sure, how can we then take this information that we have and the key pieces that are specific to prevention and then adjust them with figuring out those transferable skills, really teaching them what are those generalizable in lay terms or common language. How are we going to speak so that people understand and really are clear on the role in the job description? So that's my suggestion. And with that, I think others on this call, I'm sure, have some really great ideas for specific skills or transferable skills that would be helpful for prevention specialists to succeed in their role. Do we have some favorites that we want to drop in the chat and share? Maybe something about strong communication. I love it. Public speaking, group management. Absolutely. What else? Public speaking. Ooh, love
Education.
humans. Yeah.
I'm going to help you here as they roll by.
Thank you.
Classroom management, soft skills, interpersonal and engagement. That's great. Trust building, compassion, sales. We're selling an idea. I like that one. Self-starter, ethics. You can keep up with me too, Louise.
Yeah. Public speaking, understanding
Negotiation.
that public policy piece.
Right? It's
Yeah.
important. See a lot of
Uh,
public speaking coming up.
yeah. Oh, creativity. I love that. Active listening, flexibility. I love it. Now, as a little side bonus, if people want to copy from the chat some of their favorites, you already have a great list to get started from. All right, so feel free to continue sharing. I always appreciate, I think that's some of the value in some of these webinars and presentations is really hearing from others, some of that feedback. So thank you all for sharing. I'm going to jump in. So we've conducted this job analysis. We really understand what the role of that prevention specialist is or that new hire is going to be. We can really start with the hiring process. And the first step of this is crafting that great job description. So utilizing some of those transferable skills, really understanding and articulating what the position's responsibilities are going to be is going to be helpful. So, with this job description, this is someone's first impression of your organization. So, this in a thoughtfully crafted job description does more than just list the duties. It really explains who you are and what this position would look like. You really want to convey how amazing prevention is and make everyone want to jump at the chance to apply. You want somebody to read it and by the end be like, ooh, that is my dream job. I feel like it's calling to me. I need to apply right now. So by first making sure that we have a clear title, this can help make it easy to understand and describe the role. For example, saying Substance Misuse Prevention Community Coalition Coordinator is very specific. It's long, but it's specific and informative. It also includes keywords for if somebody were to search for community, coalition, prevention, all of that information, that can be really helpful. The second one is company culture. So this is really who you are. Include a mission, vision, values, your work location. Again, this is really telling you who you and promoting your business or your organization to the to all hiring candidates because hiring is a two-way street. It's not just I'm trying to find the best candidate. They are trying to find a good fit. And so by sharing that company culture, it can also get somebody excited about applying. Included in the company culture, sharing if the work type of work is in person, if we really need that community work and being out in the community, if it's more of a hybrid position, there's some flexibility in it, or if it's a remote position, we can do it virtually from our home, things like that. Make sure to also link back to your website, social media, and contact information so that they can follow up and dig in deeper, learn more about who you are and the work that you do in prevention. When putting together that job description and responsibilities, really make sure that we can explain the role in terms that an early professional can understand. So take those skills that we named in the chat earlier, copy those out for examples. We can also share for the job responsibilities, spell things out. So instead of SPIF, Strategic Prevention Framework, and even better, a proven, evidence-based framework for walking through the process of developing strong prevention activities and really spelling it out so that it's a little bit more clear. The next piece with those requirements, make sure that we can distinguish clearly the requirements that are essential or truly requirements and our preferred skills. So this will really help attract candidates from a wider range of backgrounds and with different levels of experience. For example, there have been studies that have shown that if we require, let's say, a bachelor's degree, we can take two people with the same exact background. Maybe they have an associate's degree. If this person identifies as a male, they are more likely to apply for that position, even though they are not qualified with that minimum education requirement. Versus if they identify as a female, they are much less likely to apply. Not saying that that is 100% tried and true, but it's just that likelihood level. And so really by getting that vast array of different levels of experience, really trying to make sure what are actually those requirements. So I come from the state of Michigan. In the state of Michigan, to have the prevention specialist credential, we need that high school diploma. And so that would be a minimum requirement. Or and then recommended or preferred having that associate's, bachelor's, master's level degree, whatever that might be, experience pieces. And that really allows more people to kind of see themselves in this role. Because I've also found that in working in the field of prevention, we are lucky. And every once in a while, we get somebody who has a background in prevention to apply. But many times I'm teaching somebody those prevention skills. And I can teach somebody that hard science. It's those soft skills that we want to know. And so including requirements that are a bit more flexible will allow people to come in and have that maybe creative background or understanding of public speaking. And maybe they have a business degree or some other degree that's adjacent and can be really helpful and have that different perspective to really grow your prevention efforts. And the last one, include compensation and growth opportunities. So according to a study by Smart Recruit Online, listing a salary or a salary range increases job application numbers by 30%. And I've seen this in my own work as well. It also, by keeping a salary or salary range on the job description, you're less likely to have somebody apply who is asking for a lot more or a lot less than, well, usually it's more, asking for a lot more than what you can offer. And so it can almost self-select people out. I've had people who have wanted $200,000 plus in the field of prevention, and I could not offer that. And so including my salary range on those job descriptions was really helpful in just not even looking at some of those applicants. It also, the other thing I know in the field of prevention, there were people, well, I tried to pay my staff as best I could. They could go into the private sector, into different work, and get paid a lot more. This is a role where we had grant funding and there was limited funding and ability to really grow that grow in that role. And so but what I could do is offer a really nice culture, workplace culture where people just felt much more at ease, relaxed, casual. We had work flexibility. I didn't make or maintain certain hours of the day. Instead, I had core hours. So if somebody wanted to get up and start working at 5 a.m., they could start working at 5 a.m. And if they were someone like me who wanted to start at 8, or we had other colleagues starting at 9, 9:30, as long as they were there for those core work hours to schedule meetings, they could flex their time and work additional outside hours, which really helped with employees who had families, kiddos, or other responsibilities in managing some of that. I would put together a full compensation report with all of their benefits because, again, I might be paying somebody maybe $5,000 less than another organization, but my overall compensation, so employees didn't have to pay for their healthcare premiums each month. And that adds up to possibly around that same price. And so if you're looking at the total compensation rather than just the salary and including some of that information, you might include a few more people who aren't necessarily thinking about that. So all of that will help with some of this. Really highlight what the applicant benefits are. So in addition to people got healthcare, vision, dental insurance, life insurance, things like that. We also there was a 403B and or 401k. Also share their opportunities to go to national conferences. I don't know if I'd list, if that's an opportunity for these new hires. There are opportunities for continual growth, and we will support funding credentialing or training for credentialing if that's possible within your organization. So, what are all of those opportunities that person can learn to grow? Opportunities for leadership development skills, things like that. You can include all of that in there, and to really highlight who you are. So, I also see having soft skills like using email calendars and knowing how to use Microsoft Office products or Canva. Those can be really great skills to also include, especially because they can be a bit more tedious to learn. And there are great resources like LinkedIn Learning, Coursera, YouTube that will all help with some of that. Supervision hours could absolutely be an added benefit for sure, and making sure to put that in. So some other considerations when it comes to the job description, again, our words matter, and we could be unintentionally stopping people or cautioning people from applying due to the language we post. So the first, avoiding biased language and stereotypes. An example, use chairperson instead of chairman of a board or of a coalition. And other gender neutral pronouns, or just say you rather than he or she, they is a bit more gender neutral. And really focus on those objective job related qualities, maybe collaborative, analytical, detail oriented, things like that. The second one, use clear language and spell things out. So talk about substance misuse or substance use disorder rather than SUD. SUD prevention specialist really doesn't explain too much if you're not from the field. Public health theory and frameworks or evidence-based processes rather than the SPIF. Number 3, focus on skills. For example, maybe acts as a community advocate and change agent, or proactively engages new partners and community members, builds trust and expands networks to strengthen prevention efforts and community reach. Or maybe we want to say skilled at convening community stakeholders from various backgrounds. All of those really focus on some of those skills rather than specific pieces from a job description. Number 4, indicate that salary range. Again, we talked about that on the last slide, but that's really important and helpful in order to include and get more people to to apply to this position. And lastly, leave out unnecessary requirements. And we started to talk about this earlier, but really making sure if there's particular educational institutions or certain number of years of experience that are possibly unrealistic or unnecessary, just leave them out. Or put them, if you really have to, put them in a more of preferred rather than a requirement. You'll get a lot more applicants, and you might find a really great person who doesn't necessarily have those traditional skills or background that you were initially anticipating. So, I have a little quiz for us. We get to go back to Mentimeter. If you want to reopen that page, that tab on your phone or on your computer, if you can't find it again, feel free to go back into that QR code or go to menti.com and type the code in. Rebecca just shared it in the chat. When we are putting together a job description, should we write a passion for substance misuse prevention, community health, or youth development, or a passion for SUD work? What's the better way to phrase this? All right, we have a lot of people sharing pretty quickly, and everybody is picking the same answers, so it doesn't look like I stumped anyone here. And I will, let's see. Show correct answer. There we go. So absolutely. A passion for substance misuse prevention, community health, or youth development. I prefer this over a passion for SUD work because it describes what you are asking for a little bit further, and it broadens, not just, I mean, SUD is an acronym. So what if people don't know what SUD work is? And second, it broadens it a little bit. So somebody who might not have that background, there we go. Yeah, absolutely. Using industry jargon is sometimes a barrier. And so broadening it. And we could probably improve on even the one that we selected further, right? All right, the next one. What should we have written? Must have a reliable car and driver's license, or must have reliable transportation to attend community events and meetings? Mileage reimbursement available. All right, we have 40 out of 60 people have responded. Oh, we're getting a few more in. We always get a few. And we have one person who said must have a reliable car and driver's license. Okay, now we're up to two. Any other hesitators that aren't quite sure? And luckily, the nice thing about Mentimeter is that it's anonymous. So if you're not sure, I can't tell who you are and what you selected. So try to select something, even if you're unsure. And with that, I'm seeing a few more trickle in. You can continue to trickle in. So I had put that we must have reliable transportation to attend community events and meetings. If that is true, I will say if you actually do need a reliable car and driver's license for that role, and just having reliable transportation isn't, you might need that car and maybe even a special license in order to perform the role of that job, then absolutely include it. So Abby made a great point. It really depends on that job's needs. If we don't get mileage reimbursement, don't include that. And if the purpose for having something like reliable car and driver's license is really so people can attend community events and meetings, maybe just reliable transportation or the ability to get to community events and meetings, rather than what it is. If you do need to be insured by a certain agency, make sure to include that, things like that. Absolutely. So it does definitely depend, and let's not create barriers unintentionally. Does that make sense to people? Cool. All right, let's go on with the next one. Really, so what should we put on our job description? Looking for a cultural fit with our team, or looking for a candidate who can contribute to and thrive in a collaborative environment? Cultural fit or a candidate who can contribute to and thrive? Hmm. All right. I think most people have kind of trickled in. Let me share. Oh, let me share the results if I can. All right. So correct. I selected looking for a candidate who can contribute and thrive in a collaborative team environment. Really, because it's much more cultural fit is vague. Yeah, Salvador, you were spot on. It's subjective. It's vague. What does that mean? And so, if we can spell it out, so contribute to and thrive in that team environment, if that's the environment, really describe what you mean by that cultural fit can really help in preferred language. All right, last one. What should we write? Some evening and weekend hours may be required with advance notice, flexible scheduling options available, or must be available to work evenings and weekends as needed. All right, I'm seeing a little bit of, we're having both. There's a bit of a split, but a lot more people are saying that first one. I also, as a side note, I don't know, but it's very relaxing to me to kind of watch these dots join the screen. So I appreciate that. Unrelated, but that's always the fun side piece of um, side side note with Mentimeter. So this is another one that like the driving one, if we do have to work evenings and weekends, um, absolutely put that and include that. We don't want to set someone up for not understanding or not feeling like the job description matches the work that they are asked to do. And if we can soften it with that advanced notice in flexible scheduling options, then absolutely include that. And so the more specific that we can be, and if there is flexibility, including some of that flexibility may help open us up to a wider candidate pool. With that being said, again, if they do need to work evenings and weekends, and they're frequent with very little advance notice, maybe that second one is important to share. That way, you're not hiring and telling somebody that may or may not be true and setting somebody up for disappointment. Cool. All right. So we have hired, or we have up with this job analysis. We know who we want to bring onto the team. We've written that job description. Now we're ready to begin that search process. If you want to have that broad reach, consider where and how you advertise these job openings. By using current employees' personal networks, online platforms like Indeed, professional organizations, job fairs, social media, employer networks, things like that, we can tap into that broader pool of candidates spanning different age groups, experiences, backgrounds, and skill sets. And this multifaceted approach really increases the likelihood of reaching that broad array of qualified candidates and finding the right fit for your organization. So where we post really matters. If we only post to our website or Indeed hiring platform, we limit our visibility. We could cast a wider net by possibly posting on our state certification job board. So if you are in the state of Michigan, MCBAP, Michigan Certification Board for Addiction Professionals, has a job board that you can post to. If you are part of another state, definitely look into that. If not, maybe they're willing to share it out as part of their newsletter or regular communications that they send out to the network. You can also look at your state nonprofit association. There might be local foundation or community group job boards. If you have a statewide job board, again, coming from Michigan, we have the Michigan Talent Connect or the Talent Connect platform. And so we can post there just as another opportunity to get that broader reach. You can look at community-based organization newsletters. Look at LinkedIn or social media. I know I always had staff share in their alumni groups on social media because sometimes that could get further just candidates, or they could pass it along to their networks that it might best fit with. Handshake is a really great platform for college students. So if you are looking for college students or new professionals, Handshake might be a really great platform. You can also look at, think outside the box. Where are those candidates? I like to work backwards a little bit. So I know the role that I'm hiring for. Where might those candidates already be? What spaces are they in? If you are looking for someone who loves some of the public speaking or community advocacy, maybe they're going to your local town halls. Maybe they are attending your PTA groups. Parent teacher associations. Maybe they are active in other community coalitions. How can we reach out and connect with them? Will those local coalitions share out? Can we connect with professional associations that are similar to ours, LinkedIn groups, local colleges or training programs? Rather than waiting for those applicants to find you, go out and find them where they're at. All right, and I love Angela already started local university job post boards, especially for master's programs, are really great spaces. Is there anywhere else that others have found that isn't listed here that we want to share in the chat? And I recognize as you share, where are some other places that we can post our job positions, postings? Every community is unique, so really identifying the spaces that really work within your community and building relationships within those places can be helpful. Idealist, I haven't heard of that one. That's great. Okay, Lakeshore Nonprofit Alliance. So we have a specific alliance that's local. Oh, the Local United Way is a really fantastic resource. Absolutely. Base camp groups. Yeah. And I love how it's specific to those different locations. So, for example, Lakeshore Nonprofit Alliance may not be for me, but it's going to be for somebody else. MCBAP, yep, somebody else in Michigan. Woo woo. The Boys and Girls Club, yes. Other groups, community agencies that are doing similar work, who likely have newsletters or networks that might have some crossover, but not specific to us. CADCA, if CADCA is willing to share. CADCA also has their community job board, and in some states, they are state specific, and so you could share in there as well. The local health department or behavioral health, absolutely. Military veteran job boards can also be a great one. Disability advocacy groups. Cool. Public library. Ooh, brilliant. So again, another spot where copy from your colleagues, copy this out of the chat because we have some brilliant ideas. And that's where we can list sororities, fraternities, churches, places of worship. Absolutely. We can use this in our next job hire. Chamber of Commerce, yes. All right. Coming up with all these brilliant ideas. All right. So now we have our job description. We have posted, and we are really excited because we have maybe 35, 40 plus candidates who are all have like great experience, and we are going to have a fantastic time interviewing and finding a top quality candidate. When it comes to interviewing, things can go sideways fast. So I do have a few tips for keeping the process going smoothly, but I do also recommend if it's your first time, you might want to connect with an HR professional or a law professional, an attorney, to dig into things a bit deeper before setting up that first interview. Just making sure that you know what questions you are allowed to ask, what questions you cannot ask, how to ask some of these questions. I'll share some basic guidance here, but this is definitely an area if you don't have that background or expertise to dig in a little bit further on your own. So the first one, anonymized screening. So wherever possible, really try to remove those identifying details from applications. This could be names, graduation years, addresses, gendered information, anything that might guide you or give some sort of potential bias when you are looking at and screening resumes. An example. So again, I've worked in the state of Michigan. If anybody has hired anybody nationally, you know there are extra steps and processes in place. The other piece, for the work that this person was doing, they really needed to understand the state of Michigan. And so we really limited our search to those who were willing to relocate or already in Michigan. You had to be a resident in order to have the position or become a resident. And so we did have somebody with really great work experience. I think they were working for their state Department of Health and Human Services, apply for the position. And someone in our organization almost screened them out because they were from a different state and they had a different address. This is a really great qualified candidate. We ended up not moving forward with them, but it was for a different reason. I slowed down and I reached out and first just asked, are you willing to relocate? Did you see this piece, this requirement on our job posting? And want to confirm before we move forward. And this person said, yes, they saw it. They were actually, their spouse had gotten a new job in Michigan and they were looking to move and this person needed a new job, a new position or was looking for a new position in the state of Michigan in the next, I don't know if it was 3, 6 months, something like that. And so we almost missed out on a really great candidate just by unintentionally screening them out due to their address. So really making sure we're going to anonymize. And then if there are basic requirements, we could have somebody reach out and just confirm some of those before we move forward with an interview. So really important. Another recommendation that I have is using structured interviews. And this is where my partner and I kind of go back and forth on. My partner will tell me, well, that's boring, Louise. Then you don't get good conversation and natural flow. And I think that's an easy shortcut out. I don't think that's true. By using structured interviews, and what I mean by structured interviews is the same set of questions in the same order for every candidate. You can still have a good conversation if you set up the questions properly. But those having structured interviews really allows you to compare apples to apples rather than apples to oranges. Because if I'm asking two different people different questions, or if I am asking things in a different order, it might produce different responses that the other person didn't have the opportunity to answer. And so really making sure that we're asking those interview questions in a very structured way can be helpful. I also tend to ask behavioral questions. This could be something like, tell me about a time when You had to manage conflict and how you resolved conflict in the workplace or something like that. This really assesses real world problem solving and past experiences. The other caveat with all of this, so when I was hiring, I would set 45 minutes for my interviews, for each interview. And I really stuck to this time. I think my time is valuable, their time is valuable, and it's really kind and respectful to stick to that time. And so, whatever time limit you put, 30 minutes, 45 minutes, an hour, really stick to that. And that meant I had 40 minutes for questions. And that way, they had at least 5 minutes. If I didn't end early, they had 5 minutes to ask me questions at the end. So if I only have 40 minutes, I want to be really strategic about the questions that I ask, and make sure that they really target and get to that something that'll tell me if they are a good candidate or not. So, for example, when I started out, I was always asking the greatest strength and weakness question. And I think all of us, or many of us, have probably heard that question before in an interview or heard known to at least prepare for it. And outside of the rare candidate who would tell me, oh, I have a really hard time getting to work on time and reliably turning things in, where it was really easy, like, nope, gonna cross you off the list. Um, Most of the time, people would answer in the same way Google tells you to answer these questions. And so I didn't get a lot of value from those greatest strength and weakness questions unless I asked in a very specific way or changed the question really to work for that position. So make sure you have limited questions using those really specific pieces that target what you want in that job can really help. So, Amanda, you shared that an agency asked you come home to find a baby elephant in your house. What do you do? To show people how to respond to unpredictable situations. And so, if we can get that unpredictability and that piece to it, absolutely. And if we're not getting the response or able to evaluate how well that employee or how well that candidate will be as an employee, is that worth a question worth continuing? And so, kind of weighing some of that and thinking through. Yes, reduce the risk of discussion drifting into informally or overly friendly conversation, and that evaluations are based on relevant competencies with those structured interviews. Absolutely. So these are really helpful to have. Along with this, having that rubric based evaluation or a scoring rubric to really assess. So when we are asking a question, the response that we want to get is let's take Amanda's question. So you come home to find that baby elephant. What do you do? You're going to want to know how people respond in those unpredictable situations. Are people able to be flexible, think on their toes, utilize outside resources, add that creativity? And you can put it on a scale, 1 to 4, 1 to 5, and choose what does 1 mean? They're not able to respond at all. They're completely stumped by the question. A 2 is maybe they share some light details, but they're not able to, that they have limited flexibility. Up to 4, they have that flexibility, they have that creativity. They are able to manage and assess. Some of the questions that I like to ask are things like, what do things that dig into their idea of the community that they're going to be working in and perspective of that community, different aspects of prevention or what they think of prevention. I'm going to be looking at is the language that they're using appropriate? Do they have an understanding? Are they compassionate and empathetic towards people with substance use disorders? And I'll build my scoring rubric based on that. This also helps when you have 2 really strong candidates and you're not sure what to pick between. You can average those scores. And it'll take out some of that personal bias and really highlight that best fit candidate. Hi. I love these responses. Call animal control to find out what the baby elephant would eat. Absolutely. Great ideas. See, we're thinking on our toes. All right. I just spoke a lot. I'm going to let Erin jump in. Did we have any questions in the Q&A before we move on to our next section?
We did not. I don't see any questions in the Q&A at this point, but if you have any, just so we don't lose them in the chat, please drop them in the Q&A section, and I'm continuing to keep my eye out there.
Cool. And if you have them, I'm not monitoring. I'm monitoring the chat, but not necessarily the Q&A, so you will not slow me down. If you have questions, just type them in immediately, and we will slow down and walk through them. But I really appreciate the engagement, and we are going to continue on with onboarding. So we have posted the job description. We've gotten a great laundry list of responses or resumes in, some fantastic cover letters. We have interviewed people and we have selected that perfect candidate. We are so excited. We do a little happy dance. We celebrate. We offered them the position and then crossed our fingers and maybe our toes, and they accepted within an hour and a half because they were watching their computer for the offer letter, and this is their dream job, and they are so excited. The work isn't over. Now we have to prepare for onboarding, right? And before I jump in and tell you all of my special tips and tricks, I do want a quick ask. What do you wish you had when you were onboarded? Feel free to type that into the chat. What do you wish you had when you were onboarded? And as you go and share what you wish you had, I'll share with you a little bit about my experience. When I was joined my last position, I it was one of my first jobs right out of college, off campus, and I knew very little. The position was going to be starting a few weeks out because we needed to work around a big vacation that I had planned. Because of this, there was some delay in getting started. My executive director, we were a group of maybe 5, 6 people in the office at the time. My executive director, who was supervising all of us because we were so small, was going to be at CADCA that year. And so out of the office, out of the state, and not super responsive. And so I walk in that first day. First, I didn't get a lot of communication leading up to the start. And so I was always reaching out like, hey, is this job still a thing? Am I still starting on this date? Is everything good to go? And then once I started, day one, I walk in, our administrative assistant, who was helpful and kind, but didn't have the understanding of what my role was, said, "Here's your laptop. Have fun. I don't really know what you're supposed to do, but you'll figure it out." And week one was kind of spinning and unsure of where to go or what to do. And so with that, I determined I was going to, when I hired somebody, I was not going to have give them the same experience I had, and really
Mhm.
provide some more structure in some of that. And
We
so,
definitely see in the chat, we see a lot of those same themes. Um, a lot of a better job description, more detail, responsibilities, clear direction, understanding the services, onboarding, staff binder, kind of that same secondary mentoring and training. Um,
mhm.
so kind of some of that same access to a shared drive that had how-to guides, kinds of things to make sure that you knew how processes worked in addition to just your job. Clear direction from team leaders on what projects they wanted me to do. Like really similar. This one I like a lot. Unwritten rules of the organization, clear expectations of the job. I like that unwritten rules of the organization. What are the unwritten? Um, Acronym list. Um, Yeah, these are all great and really kind of reflect what your experience was, Luis, is wanting to have someone to tell you, get you started, get you settled, and share with you some of those expectations, um, give you some of that basic information to get started.
I love that. And Ricky, the unwritten rules of the organization, I think you read my notes for these upcoming slides. So I absolutely love it. Um, it's part of the process to learn trial by fire and how to manage some of that. Feel free if there are some pieces of this where you're like, oh, I wish I had an acronym list as well, or that's a really great idea. Take note of that and start to utilize that in the future. Like I said, this is kind of how I figured out best practice for onboarding, and then I tweaked it. So, as I mentioned, I had very little structure in my onboarding process, for better or worse. I decided I was going to change it up. So, I had a beautiful 140 slide presentation telling somebody, that new hire, all about prevention, all about our organization and their goals and all policy and procedure, everything that they might need to know. And about an hour and a half in, I think I got the glazed over eyes and over feelings of overwhelm. You can just see it on their face. And like, I don't know what I just got myself into. And I realized I just did information dump and overload and completely overwhelmed them. The role of onboarding is capacity building, not information transfer. And so I had to then scale it back and figure out what is that happy medium. Really understanding the goal of onboarding is capacity building, not information transfer. So, a little further research with some of that. 88% of employees say their employer did a poor job with onboarding. Of those, nearly 30% leave within the first 90 days. And another study found employees are 58% more likely to stay with a company for 3 years if they have a structured onboarding experience. So I recognize this takes some time, but if you document and streamline it for future hires, this can save you a ton of time in the long run. It can also really help with recruiting and engaging coalition members and volunteers. And so if you have it for one, you can transfer it over and it might be different, but at least the overall structure and some of those core pieces are going to be similar or the same. I love, Jody, you have an online learning management system, which is amazing with personalized mentoring and coaching. And we're going to talk about some of that as an option. So if you have that, fantastic. If you don't, let's see how we can replicate it with some of those smaller organizations. So, what does readiness mean? The goal of onboarding, and I know onboarding is successful when that person knows what is expected of them, when they know who to ask. So, they don't have all the answers yet, but they know who to ask to get the correct answer. They feel safe asking those questions. So, a little bit of that psychological safety. They feel okay opening up and sharing when they don't have the answer or don't know, and they can take action without triple checking everything. So I don't need to teach them everything. I just need to set them up for success. And I break this into 3 different horizons or 3 different periods. So the first one being the gap period, really before that person starts, before day one. The second one is the connection phase. So that's the first week of employment. And then the ramp up. So the first 30, 60, and 90 days. And how are we going to support them? We're going to start with the gap period or before day one, pre-boarding. This is probably one of the more commonly missed aspects of onboarding, but it really matters. So as I mentioned, I didn't get a lot of feedback, which made me wonder what's going on with my new with the employment. I got no details prior to day one, and so having an email or a short video welcoming them to the team, sharing information. I included things like where to park, what the plan was for lunch, if they could, that we had a kitchenette with a microwave and a fridge if they wanted to reheat something and bring something. Also, where that I could share where local restaurants were if they wanted to take time off, and that they had X amount of time to grab lunch during that first day, just so that they were set up for success. I shared with them how to find our office. I shared with them my cell phone number. I shared with them maybe what the first week was going to look like or what day one was going to look like so they could know what to expect. I shared that our temperature control system was a little wonky. So sometimes, dress in layers, things like that. All of those commonly missed pieces could be really helpful, or unwritten rules might be helpful here or in that connection phase in week one. Make sure to run a background check if that's a requirement for nearly all of our roles, I'm pretty sure. So making sure that's important and in. I-9 and tax documents, getting that set up if you already have that. Or if you're doing the I-9 on days 1 through 3, because it has to be completed by day 3, in that onboarding document, making sure that you include that information so that they know day 1, these are the documents that I need to bring in to verify employment, and I need to have this by day 3. It can be really helpful. Create business cards for them. It's those little things that make them feel comfortable and welcome to the team. Set up their laptop. Make sure you have Zoom downloaded if you use Zoom so that they don't have to download it on day 1. Again, those little things really help. Another thing, you would see me the day before going in and taking a Clorox wipe to their desk and making sure everything was dusted off. Because if I walked into my office on day 1 and saw dust on there, it just doesn't feel as cozy and warm. I would have a staff write on their whiteboard, "Hi, how are you? So excited to meet you," something like that. All of those are really great. Make sure that you are all set up so when they come in day 1, they have the keys to the office. They have the laptop already set up. They have anything that needs to be printed is printed. They have access to the materials that they need to be fully successful. The next piece, so connection phase during week 1, make sure to tour the office. So I had that nice, beautiful 140 slide PowerPoint or whatever it was, but they didn't know where the bathroom was. They didn't know where to refill their water bottle. Tour the office can be helpful. Have those buddy or mentor introductions. So for those who already have that online system, fantastic, great resource. Absolutely use. If not, if there's someone in your office who could mentor, who wants to build up their supervision skills, might be a really great resource for them to have that buddy or mentor. Otherwise, I reached out to other coalitions or agencies nearby that were doing similar work and asked if they had somebody who was trying to build up their leadership skills and wanted to enhance those and was willing to mentor or buddy up with this person. And so that would be really helpful. I put together a training schedule for the week. I'd sent reoccurring meeting invites. And then I sent the internal message to all employees, welcoming them to the team. And I knew I had all of this set up on a checklist prior to day 1, so I didn't feel scattered that first week because it's a lot. All right. And then the ramp up. So 30, 60, 90 days. Where do we want to develop our roadmap, or how do we want to develop this roadmap for our career within the agency? What are some of those benefits? How can we begin that credentialing process? Where do we register for ethics, SAPs, and prevention core competency training? Things like that can all be in the ramp up. Like I said, it's capacity building, not information transfer. So what can we push to beyond week 1? What do they not need to know? What do they need to know day 1? What do they need to know week 1? And what can we push to that ramp up, that 30, 60, 90 days as they slowly get acclimated and it doesn't feel too much? This might also be a great time to revisit things that we went over quickly on days 1 or 2 and didn't retain necessarily because there's just so much information. There's a lot of new stuff coming in. I think it's also a good time, write a handwritten note or recognize, send an email. I see you're doing X, Y, and Z. Get really specific. Really make them feel part of the team can be helpful here. And so all of that really builds to a strong piece. With that, I have some resources for new professionals. One of those is My First Year in Prevention. This was built by Mariah Flynn. Yeah, created by Mariah Flynn with the New England PTTC as part of her RAD fellowship. Really great resource for somebody in their first year. I also have a link through Montag Forward Solutions, my business, on resources for new prevention professionals. And it's basically a 2-page document. It's a free document. You just have to share your information so I don't get too many bots going through. But feel free to download that resource. Bunch of links to things like the PTTC and signing up for their newsletter, SAMHSA, CDC, CADCA, Community Toolbox, all of those key resources might be a really great start for some of that. And if you have any key resources that you want to share with others, feel free to drop those in the chat, and others are welcome to copy those out. But there are a lot of great resources for people getting started in their first few months. Another great one is the New England PTTC and I think Southwest PTTC have created an onboarding toolkit. And there are sections that are specific to those regions, but for the most part, the information is generalized and really helpful. So with that, we also want to create a checklist. Now that we've started to develop this, or as we go, and you can use the checklists that I have in the workbook that Rebecca shared in the presentation already. Use that as a starting point, but start to document at a minimum as you are hiring that next person. Start to document what are some of those pieces that are needed, because that will help you replicate it a little bit more easily the next time and make your life a whole lot easier. Because otherwise, hiring and onboarding takes so much time, so much energy. And so by creating a checklist, it almost makes the process a little bit easier and you don't forget those little things. I spoke through that end really quickly. Before we go and ask final
And
questions, feel free. Oh,
we do have just one question in the Q&A. And
okay.
I do think you covered it a little bit earlier, but it sounds like this person has a question about how do you best handle the process when you are required to not share salary range or specifics about pay. This turns off some candidates. So if your organization says you can't do that, or if that's not a standard, what's the best way to handle that?
That's a great question. I would first inquire with curiosity as to why someone might not want to share that information and open up. And second, if that is not part of the is if that's not something that's allowed within your organization, I think just sharing the culture, the overall benefits, if you can generalize any of that information, like we offer a comprehensive salary package that's consistent with others in the area or competitive, anything to try to enhance that job posting to really entice people to apply can be helpful.
Great. Thanks for answering that.
Yeah. As people continue to think, I know I just shared a lot of information. I'm glad it was helpful for some. I'm interested, two things. Feel free to continue dropping questions into the Q&A and I will answer those in just a second. But in the meantime, I'm interested to hear what will you change about your onboarding process in the next month? So type 1 into the chat if you're going to print or download the candidate guide and prevention core competencies to highlight. Type 2 if you're going to share this content with others. Type 3 if you want to update your job descriptions. Type 4 if you're going to develop an onboarding checklist. 5 if you're going to reach out for additional support on any of these areas. Or type 6 if you are ready to dedicate a significant amount of time and do all of the above. Ooh, I'm loving this.
Yeah, looks like we have a lot of people who are committing to a lot of work, but also um, 5 and I see a lot of 4s, which is developing a checklist. I can't keep up, but this is incredible.
Yeah,
So,
I know.
this
We have
is
a little,
incredible.
I think someone's doing everything.
Yeah, I don't
Someone's
think there's
doing
one that's,
each.
yeah, there's one, every one of them has been checked at least once. Perfect.
Oh, great. So, a side note with this, as you feel free to, yeah, we have a lot to do, but take a deep breath. We can do it together. And some of it's already been done for you by copying what others are saying in the chat and by utilizing some of the resources that I shared. And feel free to utilize this in your own work. The other piece with this, as a nice side note, if you see any friends in the chat or colleagues that you have, and you see, oh, Cynthia chose number 3, updating job descriptions. I'm going to follow up with Cynthia in a month and make sure she did this, or they did this. You have a nice little accountability buddy. So make sure to check what others are doing or reach out to your colleagues and say, this is what I've committed to. Because I think the most important thing about some of these trainings and activities is, or webinars that we're engaging in, is actually following up or doing something with the information and material so it doesn't just get lost. Or work on similar tasks together. I love it, Rebecca. Thank you. Absolutely. Meet up. If you can share some of your job descriptions with each other or some of the pieces, absolutely. So my contact information is on this last slide. You can also use the QR code. Feel free to reach out if you don't want to copy or write out my contact information. I'm happy to answer more individualized questions privately, or we can reopen that Q&A if, Erin, there's anything else that people have
Yep.
asked for.
We
Yeah.
have just one more. If you have multiple staff on an interview committee, is it recommended everyone take their own individual notes, or is it best for one person to take notes to prevent making the interviewing nervous or intimidated?
Ooh, great question. So, I think getting everybody's feedback and notes is going to be really important. That's why we have multiple people in an interview. I would try to think about ways that we could decrease um, the feelings of overwhelm or too much. So if you're having one candidate come in, having 12 people in a room that they have to respond to is a lot. And so how can we balance some of that? And so they don't feel too overwhelmed, but we still get that information. And that's where that rubric might come in handy, where we can just quickly type in a number or reflect back afterward rather than during the interview process while still getting everybody's feedback and information.
Okay, that's it for the Q&A for now.
Cool. Salvador,
So
I think you have a great note about recommending a short follow-up after onboarding. I think I do this typically in the 30, 60, 90-day ramp up, really getting that feedback. Is this working and resonating with you, or are there tweaks that need to be made in the onboarding process? Absolutely.
Great. Well, should I jump in with a few ending thoughts here? Great.
absolutely.
Thank you both, Erin and Louise. I really appreciate all the work that you did on this presentation. Such valuable, important information that I know, Louise, I saw you present at a conference, which was fortunately before I was going to be onboarding a new person. So I was able to incorporate a bunch of stuff into that, and it was so helpful. So thank you. And I
Yes.
hope everybody else finds this just as helpful, which I think they are based on what's in the chat. So wanted to make sure that you all know about a few upcoming trainings, including one on prevention supervision that some of you all might be interested in attending. So the next one we have just this Thursday coming up really quickly is on engaging youth in prevention in a meaningful way. So if you work with youth in your prevention efforts in terms of having them involved in the planning and implementation of prevention, highly recommend this training. Ricky Barton's going to deliver it on March 3rd. If you do any kind of presentations within your prevention work, you present to communities, to your coalition members, to colleagues, to larger audiences like this, highly recommend that you attend Brian Klaus's training on using storytelling techniques to create a highly engaging and impactful presentations. You are welcome to join me on March 10th if you want to learn more about logic models and how to create them and how to use them. I'd love to have you there. Here is the next one on prevention, or the one I mentioned on prevention supervision. Nicole Augustine is going to lead this. It's a two-day training for 3 hours each. So this is much more intensive. There'll be breakout rooms. You'll need to talk. So it's interactive, just to let you all know. It's from 10 to 1 Central Time each day on March 17th and 18th. March 24th, Erin is going to be presenting this along with Christy Valentini-Lackner on letting go of what doesn't work, moving communities toward effective prevention. When we've presented the what does not work webinar, a lot of people are like, okay, but how do I move my communities away from those ineffective strategies? So this is the training that we are creating to help you do that. So I'd love for you to join us then. That is also an interactive training, so you'll need to be ready for breakout rooms, cameras and microphones working, etc. Make the case for prevention, crafting effective messages that build support. This was a highly requested training that Erin is going to be presenting for us. A sustainability planning intensive training course. We only have about less than 10 slots left, Erin, is that right, for this course, which will happen in April?
Yeah, less than 10.
Less than 10 now. So if you're interested in this, apply now. Priority is given to Region 5 folks. And we just opened up applications to our next virtual SAPS that's going to happen in May. Again, the priority does go to Region 5 folks for that training because of the limited number of slots. Wanted to also point out with our prevention learning portal, we do have a page on supervision for preventionists. So if you are a supervisor of preventionists and want more information, tools, etc., feel free to go to that page. Once you click on that, every page is formatted like this. There's a what is it, learn about it, and take action sections. So I encourage you to explore that. We will also put the recording of this webinar up on this page when it's ready, so you'll be able to find it there as well. As always, feel free to follow us on LinkedIn and Facebook to get information from us every day. This is how we get the information out to you on a daily basis. So if you are a social media person and would like to follow us, that would be fantastic. And last but not least, once we're close out of this webinar, you'll be redirected to our GIPRA evaluation form. This is really helpful for us to know how well this training worked for you, what worked well, what things if we did differently can make it even better. We deliver it another time. So please take the time to do that. I read every single comment, so it doesn't go into a black hole. Please know that. And with that, I'm going to check back in with Louise and Erin. Any last thoughts before we log off?
I just really appreciate being able to share, and please share all of the feedback. I am continually growing, and I will also ask Chris for that and read through that. So feel free to share your thoughts.
Great. Thank you, Louise. Erin's good. All right. And a huge thank you to Rebecca on the back end who does all the work setting all of this up, making sure technology works well throughout, and then all the follow-up work. So huge thank you to you, Rebecca. And I hope everybody has a fantastic rest of your day. Take care, everyone.